We have wonderful, amazing speakers on our first panel, which is going to be rooted very much locally, and then with our second panel is going to be able to expand it out. So very briefly, we have Dr. Dee Ann DeRoin, a longtime physician, public health advocate, and my personal mentor. She will be joined by Missty Slater, the first female chief of staff for the Iowa Nation. We also have Jason Champagne, whom you've eaten his delicious food, but today he'll be talking about nutrition education in tribal communities, along with Janis Simon, the food systems coordinator for tribes in Kansas, and Tandy Rundus, her partner in crime. So at this point, Dr. DeRoin, would you like to come to the podium and share with us a little bit about the worldview of healthcare and foodways from a tribal perspective? And would you all join me in welcoming her? Let's try that.
Okay, great. And say good morning to Olivia, and especially say hello to Ponkawi Victors, whom you may recognize her name because she was formerly a Kansas legislator for, I think, about 12 years representing the Wichita area, and we are now delighted to have her working with us in our community. So good morning, nice to have you here. Well, first of all, I want to thank the Sunflower Foundation and, of course, the Aspen Institute for inviting me and giving me the opportunity to speak to you today. It's my experience that a lot of Americans have not had many opportunities to learn about our Native communities, and it's my experience that they are happy to hear and they prefer to hear from us, and so we are delighted to have this opportunity today to share what we know and what we've learned, and of course there's always much more to learn. I wanted to tell you that first of all, we are the Ioway, or in our language it's Bahoje, and Hanwe Pi is good morning to you, good day actually. And we are actually from the Oneota.
Progress.
And they were a culture who lived along the Mississippi, and actually there are several tribes besides the Ioway who come from the Oneotas, and we recognize those other now tribes as our relatives. Now I should say too, I have an IT allergy, and so we will see how this goes. In our case, we were from the northeastern area of Iowa, and you can imagine how beautiful it is. We've got the woods, the undergrowth, the Mississippi River right there, and in addition to abundant food and beauty, it actually is also the home of some mounds, and those are burial sites of our ancestors, and so it's a very, very special place to us. And interestingly, at the moment, as far as I know, if it hasn't changed, the National Park Service is doing a wonderful job. They have a whole new policy about working with tribes, and it continues to be a beautiful, well-tended space, so you should all visit. The strange irony is, to me at least, that the federal government moved us from that land, forced us, and you will hear about the several treaties that came about, off that land. And what did they do? They gave it our name. So I've never quite figured that one out, and I haven't talked to anybody from the Iowa State Administration about how that came about. I suppose they thought we would consider it a tribute, but would really rather be home. So, and I do have one little story to tell about that homeland. One of our current tribal elders had lived and worked in that area for several years, and the closest city would be Decorah, if you're familiar with Iowa at all. And while there, he heard that there was a farm that had a cave on it. And he ultimately introduced himself, and this is Pete that I'm talking about, He introduced himself to the farmer and said he was Ioway, and it was thought that the cave had probably been used by the Ioway or Bahoje. And the farmer said, you know, I like you. Yes, I'll show you the cave. And so he took him out and showed him the cave. And the cave is thought to be special for a couple of reasons. One is that there were thought to be some petroglyphs there. And it also was thought that it may actually have been a birthing place for women to go, privacy. And so I don't know exactly how this happened, but I got invited to go with this man, Pete Fee, continuing one of our tribal elders, and two other elders to the spot. And when we got there, you know, we knocked on the farmer's door, and he met us and said, I'll be happy to take you up. It was in the fall, so we had to tromp through the corn stalks. And then he showed us the hill and the cave at the top of the hill. And he said, okay, here you are. And he went back home. And so we managed to climb. There were 3 elders, and we managed to climb up the hill and get to the cave. We didn't go deep into the cave, but you could see that there were markings on the wall. Now, they didn't look like what you and I would think of as petroglyphs, especially those of us who've had a chance to see petroglyphs. But the question was, well, there are clearly markings here, and it's either weather or it's vandals or, you know, other disrespectful people who don't understand the importance of this to us. But so we were happy that we had seen the cave, been in the cave, and then as we were climbing back down the hill and plodding through the corn stalks, a bald eagle flew overhead. And as it flew, it whistled. And I had never before heard an eagle whistle. And I haven't since. But that was the message to us, that we were in the right place. This was home. And that was how we knew for sure. Oops. Whoops just comes from the allergy. So we need to talk a little bit about treaties, and I'm not sure, but my colleagues here may talk about treaties. But the problem was that there wasn't just one treaty. You know, I think our first treaty was in 1837. And the treaties came almost every decade thereafter. And every time the treaties came, we lost more of our homeland. And we kept being moved west. And so finally, we made it to Kansas and found ourselves on the prairie. And we were very, very fortunate, sorry guys, to actually land on the Missouri River. And so the eastern border of our reservation now is the Missouri River. So we had woods, we were able to forage, we were able to hunt. You know, we didn't have buffalo, but, you know, we were able to feed ourselves in a somewhat way that was similar to how we had taken care of ourselves in northeastern Iowa. Now, the beauty of this food, whether it was meat or vegetable, berries, or greens, was that it could be dried and still had its food value, especially if you put some berries in there, you know, and it would taste good, whether it was, you know, the fall or the winter or whatever. And so this was really important to be able to have access to these foods, which we knew. And a really important thing about our foods is that they are key to our celebrations. And in fact, the Ioways, and I'm not sure about the other tribes, but we have 4 foods that we consider our sacred foods. So whenever there is a sweat or a memorial or a special occasion, we have these 4 sacred foods. And you nutritionists in the audience will be happy to know that there is major protein, there is a grain, there is a vegetable, and there are berries and water. So we cover the waterfront with the sacred foods. The last treaty with the federal government was in 1861 and managed to take half the reservation that had already been chopped up. And we had been told at the former treaty that this was the last time that any land would be taken. And there we were again. But that really wasn't the last insult. And this is to digress a bit, but just sort of put you in the era. So in 1881 is when Congress passed the Residential Boarding School Act, they called it. So, and actually, there were various religious groups had been working on residential schools or boarding schools already. And another irony is that the people who were doing that were actually the humanitarians of the time, because there were a lot of other people, especially military people, who felt that, you've heard this phrase, the only good Indian is a dead Indian. And so the humanitarian people got the federal government to pass the law that meant that the feds would actually underwrite boarding schools. The one positive thing I can share is that Haskell Indian Nations University who's heard of Haskell? Okay, well, it's good I'm bringing this up still. Haskell then was opened in 1884 as one of the first federal boarding schools in the country. And it has its own important history and continues today, and now it's a 4-year degree-granting university. But nevertheless, I digress. The thing that was really the biggest problem after the last treaty was something called the Dawes Act. And the Dawes Act was passed, and some of you actually seem to know about this. That's amazing. That's wonderful, actually, that you know that. And the Dawes Act was this great idea where they would take our reservation land and they would break it into 160-acre parcels. And every family got a parcel, and you'll be surprised to hear that the land left over was sold to settlers and traders and trappers and people who, we're talking about the Missouri River, so it was really a major resource for those people. So what happened then was that our communal lifestyle, where everybody worked together, helped each other, whether it was planting or hunting or whatever, we just looked out for everybody. And so we weren't together anymore. Everybody was on their own plot for themselves, and this was a whole new concept of a way of life. And sadly, it nearly destroyed our tribe. We have lost many traditions, almost all, but not quite, of our language, and we're working on that. Ceremonies, stories, our clans, what our clan responsibilities have been. And so this is why we, and especially our young people, are working so hard to regain these losses and strengthen our community. With this loss of healthy eating and the regular exercise that you get when you're living in a rural space and you have to hunt and forage and have all these activities, we actually were basically forced into the American economy. But I don't think that there's much evidence that transition from the reservation lifestyle to some degree or other over time becoming Americanized was very successful in terms of creating entrepreneurs and people who would work as groups again. Now, so we have had an increase in obesity and all of the diseases that follow obesity. And another thing that happened was that smoking of corporate contaminated tobacco was introduced instead of the traditional tobacco that we use in ceremonies. And this was particularly brought home by our soldiers. And of course, you probably all know that in World War II, free cigarettes were given out to everybody by the cigarette companies who were happy to get them addicted to cigarettes. And along these lines, I have to digress a minute too, because a lot of people don't know that starting in about World War II, the percentage of Native people who were serving in the armed forces was greater than the percentage of our existence in the American population. I mean, we were better represented than anybody, which I think, among other things, speaks to our having come, many of our tribes, not all of them, from a warrior society, and that was how you protected your people. And so we have, in many of our tribes, something that we call war mother societies. And I don't know if there are any other names that other tribes use for this, but it's because these people are honored. And typically, not everywhere, and every place does it differently, but there may be an annual dance and feast honoring the military folks. And then we have various kinds of cultural feasts and gatherings. They can be for as a memorial. They can be celebrating a birth, having a sweat. There are different examples of activities where we will serve foods. There are almost always cultural foods, and I will go out on a limb to say that, and we have other people who can share other ways of doing it. But there also, for better or worse, are likely to be the not so healthy foods, the Jell-Os and the store-bought desserts, chips, etc. The junk food era is alive and well on our reservations. And what we often see is that now that we're able to begin to be economically independent, not quite there yet, but that's our goal throughout the country, I would say, we have a gas station. And of course, every gas station needs a convenience store. And it's the convenience store primarily where all the junk food is. And some tribes are trying to get the chips out. A tribe that I was visiting with the health director up north, and she said, the hardest thing she has right now is getting the tribal council to be willing to get the soda pop out of the convenience store. So people are working on it everywhere, and hopefully we will have a fair amount of success. The work to counteract all of this Americanization is ongoing. It's increasingly successful. And I'm thrilled to be with these guys here who are doing it in their own individual way, both in terms of profession, role within our tribal communities. And we have had wonderful partners. We have, that we have a partnership, and I say we as formerly being with the Kansas Tribal Health Summit. And we would have an annual health education conference. And that has wonderfully evolved into CATCH, and I'm hoping that you will hear about CATCH from my colleagues here, which is the Kansas Alliance for Tribal Community Health. And so besides the Sunflower Foundation, we have as a partner KDHE, Kansas Department of Health and Environment, and we have the American Heart Association and the 4 tribes here in Kansas all working together to try to create opportunities for our tribal members to learn what is healthy, to increase their understanding, to help make the attitudes positive towards making change, and ultimately to bring our communities back to a healthy Native lifestyle that we had 100 years ago. And I think that's all I have to say today. I have given you just, an overview, and I'm hoping that the tribal people here in the audience, as well as our great panel, will speak to some of these issues. I would like to, for those of you who are interested in some native medicine, there is a fabulous book, if you don't mind reading it it's kind of like an encyclopedia, or a pharmacopoeia. But it's written by Virgil Vogel, Vogel, and I think it was first published back in the 70s. It's about that thick. But it has very interesting medicines that were used by our tribes. And the one that struck me as far as I got in the book was the use of mushrooms, for example, to put on the umbilical cord immediately after delivery to prevent infection of the umbilical cord. So that's one. And then, of course, there are tons of Native authors who are accessible to you these days, and anything by Louise Erdrich. Sherman Alexie took a little heat when the Me Too movement started, but I think that he was very straightforward and positive in terms of acknowledging that and attempting to make amends. But I would highly recommend his books, and if you want to start with something thin, and it's pretty funny, it's called The Absolute Diary of a Part-Time Indian. And it's partly his teenage transition from being on the reservation, walking into town because he wanted to go to the school in town. But a thing you need to know about Sherman that I didn't know till I read his latest book was that he had hydrocephaly. He was born with hydrocephaly. And, or that's water on the brain, people call it. And so he spent much of his first 2 years of life in a hospital. And then he went back to the reservation. His family was quite poor, had some alcohol problems, and you must see his movie, which is not coming to me. There is another person in this room who knows this. Gosh darn it. Well, I'll think of it. If it's a day or two, I'll say, what is the name of that movie? Yes! Smoke signals. Thank you. Is that what you said? Yeah. Yeah. It really is a great overview of Native life, tribal trials and tribulations, and there is a comedic aspect to it as well. So thank you very much for listening. I will be here. I'm happy to answer any questions when we're finished this morning. I do have some of those cards with my contact information on it. We'll be happy to share them. So thank you. Thank you.
Thank you so much, Dr. DeRoin. And Misty, I will let you introduce yourself. And your slides are good to go.
Okay, let's see. This is a hot mic. Good, good. I just didn't want the feedback, so I wanted to turn this one off first. Thank you so much, Dr. DeRoin, for starting the panel off in such a good direction. So thank you. And thank you all for coming and attending today. Aha, minye Missty Slater iganyeki. My name is Missty Slater. I'm a member of the Iowa Tribe of Kansas and Nebraska. I am a proud Ioway woman. I'm also going to give a quick shout out to Paul Austin, who's our clinic director, who's sitting over in the corner. I will also say, for anyone who is a research or evaluation geek, another good book recommendation before I jump in, I was in love with Braiding Sweetgrass. It's a really great kind of comparison of kind of colonized research and data collection and evaluation versus a decolonized sort of approach through one woman's story. So if anyone is interested in that, I really loved it. It's also a great audiobook. Her voice is so relaxing and calming. So feel free to that's how I consumed it, is via audiobook. So I'm going to talk a little bit about food as medicine. You will note on this slide, it says a plan for the Iowa Tribe of Kansas and Nebraska. And I did that very specifically because we are not yet launching our program until this spring. We have not launched it. We have received some funding, and we have planned with our staff and with our tribal leadership, but we haven't launched it yet. Dr. DeRoin gave an amazing overview of the history of the tribe, but I wanted to point out just a little bit, just in case folks are not familiar. You'll see our lands. Traditionally, our ancestral homelands and some of our encampments have been in a very large swath of the kind of upper Midwest area, and you'll see our reservation, that little tiny brown spot, stretching into Kansas, Nebraska, and Doniphan County, Brown County, and Richardson County, all the way up to the river. And a little bit about the Iowa tribe. Thank you, Dr. DeRoin. I'm probably going to just flip through some of this because she gave a great history. We are also known as the Ioway Bakoje. We have about 4,900 tribal members. These are members all across the country. These are not necessarily just the people who live on our reservation or near our reservation. And in fact, I say all across the world because we do have a few folks living internationally. We traditionally, for centuries, had our economy based largely on agriculture and trade of our agricultural products. So for that reason, we are really trying to embed our current tribal economy in agriculture and in trade, and really embed tradition, using our traditional ecological knowledge through a regenerative agriculture model in order to help grow our economy that way. And we really look at a kind of a holistic and layered approach to economic development. So it's agricultural production, aggregation, distribution, trade, international trade, foreign trade zone. We really try to look at an economic ecosystem that all is based on some of our culture. We also have a tribally operated clinic, a 638 clinic, which is based upon Public Law 638, the Self-Determination Act. So we have exercised our sovereignty to operate our own clinic rather than have Indian Health Service operate our clinics on our behalf. Our clinic, we are blessed enough to get to serve both the Ioway and the Sac and Fox people with this clinic. So our reservations, we are neighbors, and we share our clinic services across both nations. I am pointing this specific operating model out because I think it's really important in how and why we are choosing to implement this program the way that we are. A little bit about our Food is Medicine project that we are launching. Shout out to Punkawee. We have some funding. We have an incredible partnership with Punkawee at American Heart Association. So we were able to receive some funding from American Heart Association through United Healthcare. I will say this grant is a one-year timeline. And based upon that, then a sub-grant or subcontract had to come out. And that subcontract had about a 7-month timeline. I'm pointing this out. This is not Punkawee's doing, so I am blessing her. I am giving her all of the praise. I do not recommend that tight of a timeline for anyone, but especially not in Indian country. A one-year timeline to launch, implement, and evaluate a program is really tough. Really, really tough. And a 7-month timeline is even tougher. So do not recommend that. Indian time is a real thing, and we do things precisely when they are supposed to be done. And that does not mean it has to be done in 7 months. It means it has to be done when it's supposed to be done. So for those reasons, 7 months is not a recommended timeline for a Food is Medicine program. But generally, here's our implementation plan, and I want to dig into this a little bit too. So I want to touch on a few different elements, and if anyone has questions, I'm either glad to take them now or wait until after the panel. Kind of this is how the flow of what we're thinking about for our Food is Medicine program and what we're planning for. We have received the funds. The tribe actually received the funds, and they have shifted those funds and give them over to our clinic. So now our White Cloud Health Center is our lead entity, our lead organization for our Food is Medicine program. And I say alongside Chief of Staff because they couldn't get me out of it, even if they wanted to. I am glad to help work alongside our clinic staff. I also happen, for the last few years, I serve on the board of directors for our clinic as well. So it's kind of an intuitive fit for me. Ioway Farms, which is our tribal farm, it's an LLC incorporated under our own tribal codes. They will be the ones growing our food. So the clinic will be working with the Ioway Farms to make sure that we have identified the appropriate types of food, the amounts of food based upon our clinic population and what we're anticipating to make sure they grow those right foods at the right time. Our medical providers and our clinic staff, they will be working to determine those eligible diagnoses. We have a number of diagnoses we've already brainstormed, heart disease, cancer, diabetes. We are also going to consider nutrition insecurity a diagnosis. We have confirmed there is an ICD-10 code for nutrition insecurity. So that will be an eligible diagnosis for our Food as Medicine program in order to prevent other chronic diseases. So it's medicine to help treat diseases, but also to help prevent diseases as well. We actually, as Dr. DeRoin mentioned, we have a gas station. We have a convenience store, Grandview Oil. That is our one and only food sales avenue on the reservation. It is another tribal-owned LLC. It is incorporated under our tribal code. So it is a tribal-ran convenience store. So we are going to work with them to find the right shelf space, the right cooler space, and get those foods in that gas station. We are working with our pharmacist, Paul, who is also our clinic director, on the actual prescription voucher program. So it's going to be a prescription that will serve almost as a voucher to help develop an invoice. So while the clinic patients take those vouchers to our gas station, they can cash it in for a certain dollar amount that then gets tracked, and the gas station will invoice the clinic for those costs that will get charged to the grant. I bring all of this up because I have been saying for years, which is why they couldn't get me out of this, that tribes are like the perfect proving ground for a Food as Medicine program. We have the executive committee. Some tribes have tribal councils. We have an executive committee that are our decision makers. And while we have boards that are the decision makers, it's really all under the same operational umbrella. So when we make one decision that these are our priorities to serve our people with better, healthier food and to use food as medicine to grow healthier people, now it's a matter of just coordinating all within our team. So a few other supports, and I really want to make sure I touch on these because we've got Jason and we've got Janis and Tandy and we've got some amazing researchers in the room as well. All of this can be layered in for even more impact. Other things that we would like to do, and we're going to be, for those of you that, I'm reaching out to you guys for some of these things. We want to do Food as Medicine with education and cooking classes. Because if we distribute healthy food, but our young people don't even know what to do with it, don't even know how to cook it, what's the point? So we want to be doing some of those education, those cooking classes, those healthy recipes. We definitely want to make sure we have youth engagement. Because this is primarily going to be a clinic-based intervention where it starts, but we really need to layer in these other supports to make it successful. So we've got a Boys and Girls Club on our reservation. So we'll want to make sure that we work with the board for our Boys and Girls Club and our executive director, Courtney, to make sure we're bringing our youth in to some of these initiatives and maybe even give them a say in what they want to see moving forward. We actually also want to work with our social workers, our social services program, because they do home visits, they do outreach. They can also help identify people who are nutrition insecure that may not be going to the clinic just yet or may not be reporting that to the clinic. They might be going because they want contraceptives, but not saying, also, I'm struggling to get enough food. They might not be reporting that to the clinic. So we want to work with our social services to help also give them this little incentive, because sometimes people don't always want to share those things. But if they can offer those supports and those resources, it will open the door for some of our social workers as well. And making sure we incorporate culturally relevant foods in other medicines. Not everything might be paid for under a Food as Medicine grant, but we want to make sure that we continue to consider how we might incorporate more traditional medicines that also happen to be foods rather than food as medicine. So we've discussed elderberries at length, elderberry syrups and tinctures and things like that. So that might not be something that people would say, oh, I'm just gonna just sit down and eat a snack of elderberries. They might, but an elderberry tincture as a medicine that is derived from food might be something different. So we're not exactly certain how we're gonna make sure we bring those in, but we are planning to layer in culturally relevant foods and medicines. And then gardening and sustainability. Again, this is not a part of a food as medicine program, but we also may want to distribute things like garden boxes. Oh, if you really like these foods, you don't need to have Ioway farms always grow this for you. You could actually do it yourself. You don't have to depend on us if you want to grow it yourself. So how do we layer in that education? Now that they've been, exposed to the foods, the recipes, the cooking classes, that they are now familiar with the foods, they want to continue to eat the foods, we can also add in that sustainability piece. Again, always including our regenerative, sustainable models. That's kind of at the core of everything we do. I like to say our tribal council makes decisions with life at the core of every decision. Whether that is the life of the microbiome in the soil. We consider the life of our human relatives, but also our non-human relatives. So with life at the center of everything we do, the soil, the water, the plants, the trees, the people. We are going to be doing an evaluation process. I really hoped to have our RFP done, but I just didn't get a chance to put the finishing touches on it and send it to the board for approval prior to today. But I'm hoping I can get that finished up maybe next week. So if there's anyone interested in putting in a proposal to help us evaluate the impact of our program, come see me. I do have a whole stack of business cards in my pocket. But with our evaluation plan, and I think many people will probably understand this, data sovereignty is really, really important to us. So we want to make sure that we own our data. We own the process. We have say over how our tribal members get communicated with. And we do want to work with an evaluator to help lead that process on our behalf. But we want to make sure we are data sovereign and we don't give up that data to someone else that can then write it into a grant that then they get money for, and then we know nothing about it. And then that funder has that data and then they can share it with someone else because it was written into a grant. And then our data is no longer ours and we have no idea who has access to it. One thing I do want to mention, in case anyone doesn't have exposure to working with tribal communities, traditionally, our stories are our data. It's not numbers necessarily. Think of how did we figure out what foods were safe to eat and not to eat? Well, it was a little bit of research. It was a little bit of evaluation. Let's test the food. Oh, that was really bad. Now I'm going to tell the story of this is what happened to me when I ate that mushroom. This is what happened to me when I ate that plant. Our stories are our data. So we want to, I don't want to say own. Own is not the right word for our stories, but we want to make sure people don't share our stories without our permission, especially if it's a part of our evaluation plan. And I don't like the word own for our stories, but just being sensitive that we do consider that our data and a part of our sovereignty. So I really just kind of wanted to give you a highlight of kind of the plans, how that we plan to work this over 2024. I think we're going to learn a lot along the way. What I put on this slide, if you ask me again in January of 2025 for how we implement 2025's program, it's probably going to be different. And that's great. That's also why we need evaluation. But I have my email address. That's my work cell phone number too. I respond much better to text. I am a true millennial. So feel free to take photos of that. I also have my business cards with me with the same contact information. If you are at all interested in being a part of our evaluation of our program, shoot me an email, come see me, I'll give you a card. I'm going to be sending out a request for proposals for this scope of work hopefully next week, and making a decision in the next couple weeks after that. So I would love to hear from you all. I would also love to be able to share some of these stories with you all or with any tribal community who is interested in implementing a program in 2025.
Thank you so much, Misty. Thank you, thank you. If you will, since Dr. D, that was so considerate of you to give up your seat so I could, but for Q&A, you might have to come back up. So, wow, that was incredible. I wasn't expecting that. That was awesome, Misty. You go, girl. So we're going to talk just briefly now about, you've heard big picture view, health and food. We got to hear about an exciting case study, and Misty mentioned education and how important that is. And so we're going to take just a few minutes to talk to 3 people that are doing nutrition education in tribal communities or have done, and they have some insights from us to share. So Jason, if I can turn to you first. We've heard from you as master chef. But you also have another side besides making food. You like to teach about the food. So could you tell us just a little bit about your passion for nutrition education in tribal communities?
Yeah, so thank you. Thank you for that. Jason Champagne, I'm a proud member of the Red Lake Band of Chippewa. I work with a lot of people, a lot of Native communities, a lot of non-Native communities, but work with a lot of kids, elders, senior citizens, and my passion is to teach culinary arts. I want to teach, and people say, well, go work for a culinary school then. I can't do what I want to do in a culinary school. It's pre-structured. They tell you what to do. And, leaving working for the richest tribe in the United States, teaching the Shakopee Medewa Canton Sioux community how to cook for 3 years, I came home looking for a job to do that, and I couldn't find one. And so I thought to myself, well, if I can't find it, I'm going to create it. So I created Native Chef LLC to promote health and wellness using culinary arts and getting people hands-on food, getting people learning how to use a knife, kitchen fundamentals, cleaning as you go, safe shopping, internal temperatures of food, cross-contamination, everything that has to do with safety and food and healthy food and making it beautiful visually on the plate. That's what I teach with my program.
And I've heard you talk before about when you go in with sort of your MPH hat, nutrition educator, and you're teaching to some tribal communities. You've shared stories about maybe some tension that's arisen when you've said the fry bread might not. Just talk to us about some of the tension.
Okay, so let me give you a perfect example. I was talking into a Native community, doing a cooking demonstration, and then talking about fry bread. And I'm diabetic. Unfortunately, I've been off and on meds. I'm back on meds. I'm trying to get back off meds. The whole point of what I do is to promote that, even though it's in genetics, and the doctors say, well, don't worry, Jason, it's genetic, right? I'm trying to prove that I can use food and exercise to get off medication, even though it's ravished my whole family. So I'm talking about that story, and I'm talking about how fry bread elevates my levels. 2 days after eating fry bread, my glucose remains high when I check it. And I started talking about the bad stuff about it, and I had an elder almost in tears telling me, you can't talk about fry bread like that. We used fry bread. Fry bread helped save our people from starvation, and we celebrate fry bread. And I was blown away. I was shocked that she was that upset. And so I got from that we just can't walk into these communities and tell these Native American people, do not eat fry bread anymore. That can't happen, because if you think about it, some of them don't have a lot of money, and it's very, very cheap to make fry bread. And they get flour and commodities, and they get lard, and they can make a big batch for not very much money. And they invite their family over, and it's a feast, and they're celebrating, and they're eating, and that might be the only food they get. So instead of going in and telling them how bad it is, just educate this piece of fry bread with carbs and fat versus this size, right? Maybe cutting down 1 or 2. But it's a tough disconnect because, fry bread is not a traditional food. And I get upset all the time when I hear people say, fry bread. If I meet a non-native, they're always, oh, I like that fry bread, that stuff, And, it was actually a food that helped us survive on reservations.
And for those here that maybe don't know the history of fry bread, which I know is worth many a dissertation, can you briefly tell us what's the origin of fry bread?
So the origin of fry bread was when Native Americans were put on reservations, they were given meat, they were given, certain things, but they started cutting that back. They started getting rotten meat, and they started basically starving. But the three things that they had lard, they had flour, and they had water. So instead of starving to death, they created this thing that kept them alive, gave them the energy, gave them the caloric intake that they needed to survive. And so that's why a lot of Native American communities celebrate it, right? But look at what's going on: a diabetic epidemic, obesity. We're not hunting and gathering anymore. I was just thinking this morning, 200 years ago, we didn't need money. We didn't need it. If I'm right, my great-great-great-grandparents lived off the land. And now we're struggling to keep up with colonization, with the society of having to have money to pay our bills, to keep the lights on and all this. And then people say, well, how come you guys just don't develop on your reservations so you can provide some income? That's not who we are. We lived off the land 200 years ago. We didn't need the money. We didn't need it. And so I've made it a goal in my life to try to live as cheap as I can. Try to do things that are free. Go for a walk. That doesn't cost any money. Try to enjoy life without having to worry about that green thing that tears us apart and causes depression and anxiety and all these issues and suicide and drug use and all this stuff that's going on. It's just our people didn't need the money, and now we have to have it, right? So.
Thank you, Jason. I'm so sorry you have to follow him because he's so eloquent. No, thank you so much for. And here you can vote. This one's on. So you all run nutrition SNAP-Ed programs in Kansas tribal communities, and over the last few years have developed a lot of ways to make them more culturally acceptable. So can you just share with us how you've been doing that?
Okay, I am Janis Simon. I'm an enrolled Kickapoo, Kansas. Grew up there on the reservation. Know a lot of people, come from a big family. I'm number 8 out of 9 kids. Was raised by my mom and dad on Kickapoo Reservation. And how this came to be, I've been doing this for about 5 years, even though I've always worked for Native programs in one way or the other. They wanted to hire an auntie grandma, somebody that people would listen to. It's like, that'd be me. And I agree with Jason. Fried bread isn't always the best thing, but too, we didn't grow up eating fried bread all the time. We just didn't. But we did eat a lot of homemade food. We didn't eat processed food. We grew up in rural Brown County. Everybody was poor. It wasn't just the natives. Everybody was cooking from scratch. There wasn't fast food. There wasn't anywhere to go for that. So I think that's a lot of problems with people I see. It's like I know a lot of people younger than me that have had a lot of health problems, and I think that's why the fast food, the processed food, and just trying to get away from that. And how we started was Missty, the mastermind, had an idea of hiring somebody to go into the tribal communities that the tribal communities knew and start doing the curriculum that is offered through SNAP-Ed and some of the KSRE items. We have 3 other nutrition assistants that work with us. They're all tribal. The Indian world is very small, less than 6 degrees of separation. So we all have relatives there. We all kind of know the communities. We all intermixed. We're all intermarried, especially within the Kansas tribes. So what we do is we take that curriculum, and one of the main things we do is, because like SNAP will let you do a recipe, but they'll let you do, say, spend $20 on food. and everybody gets a taste. It's like, no, that don't work for us. We want a full meal, and we want to have that fellowship, and we want to sit down and talk about, yeah, how's the kids doing, or this is our time to catch up, or yeah, I make this at home, but I do this, or a variation of it, but still staying with the healthy foods. We also, from like yesterday or the other day, I heard what we're doing is the same as what a lot of other programs are doing, giving them that equipment, providing incentives. It's just, yeah, we don't do the data. And like Misty was saying, that is a very touchy part. We don't, basically the only way we know they like what they're doing is they come back for the next class. And we only take aggregate data. We don't get into the full research, and they don't want us to. Tandy, we work with elders, we work with young kids, we work with middle-aged people, because who we really want to try and get to is the people buying the groceries, especially for these young families. Like, oh, well, they only drink pop, or they're only eating junk food. Well, who buys that? If you're the parent and you're bringing that into your home, then that's kind of on you. And we need to get back to that of parents being parents, eating healthy, cooking more, and what we do is real simple recipes. It's nothing over the top, nothing expensive. We did have Jason train our nutrition assistants to encourage people to eat with their eyes and use the rainbow. Keep it simple. I don't know much more we can do for them, but yeah, we are getting into some more interesting things. We do food preds classes. We are getting into drying corn. We've done some good gardens. Oh, we do a whole array of things. We do community gardens. We do health fairs. We do community feasts. In our food press classes, we try and use vegetables from our community gardens or the raised gardens, because what we do is salsa classes, even though we have done some, not salsa, that kind of salsa, but the eating salsa. That's a whole nother culture there. Give us a training, we'll do that. But we do the salsa classes like when the harvest is coming, so we're using fresh tomatoes, fresh peppers. We actually give away everything we present at those classes. We give away jars. We give away all the canning equipment. We have done meat canning classes, which was really interesting. And I would like to get into that more, just because once COVID hit, and that's kind of when we were starting to do the classes, we had to pivot and go to virtual classes, which is really hard because that's when we found out not everybody has internet. Not everybody has access to doing Zoom, especially in rural America. So it's a growing, our classes are growing, but two, it's just understanding, meeting people where they're at. We work with all the Boys and Girls Clubs. We work with the elder sites. We help at different community events, pretty much whatever they let us do and whatever they're willing to bring us on site to do.
That's perfect, Janis. And I'm so glad you mentioned the virtual component, because you and Tandy are too modest to say, but of all the SNAP Ed educators in the state of Kansas during COVID, the tribal nutrition educators were the first to go on Zoom and kind of set the mark for the rest of the state. That was amazing. Yeah. So, yeah. That was a wonderful overview. I have one follow-up to you, Tandy. So Janis goes out and finds out what the tribal communities want to do. Then she comes back to you within the wonderful bureaucracy of a state university, research and extension.
Absolutely.
And the added wonderful bureaucracy of using federal dollars.
Oh,
So
yes.
you have to do a lot of mental machinations to figure out how can we get the money and support to do what they want to do. Can you talk a little bit about that?
Sure, and I think that has been obviously a huge challenge, but it we've come to this process through collaboration with this group that was the Tribal Health Summit Planning Committee that has evolved into the CATCH, Kansas Alliance for Tribal Community Health. And it was the collaborative work there that allowed us to come to the table maybe as a federal entity with funds to do nutrition education classes, but they were limited in certain ways. And so that connection to the American Heart Association initially allowed us a way to maybe begin an employment of Janis as a nutrition coordinator for the work. And then the individual educators were actually then employed through K-State. And we've been able to transition from that now that she's wearing purple, so she's a K-State person now too. But as she was mentioning she partially, right, I get it. As she was mentioning, the taste test piece and some of the other, again, federal programs they're tight with all those dollars. And so the Sunflower Foundation has been huge as a connector for us as well to provide some of those outside dollars that allowed us to support a whole meal then, and that environment where we really were supporting the family more. Also in that sense of, families cooking together and the kids cooking, as Janis is mentioning too. So those were all pieces that this allowed us with these additional funds to do, and ways that we just continue to bring in those ideas, listen to what, the food preservation Janis is mentioning too is, and I think the nutrition classes both, they start to lay the initial foundation that then can be built on to something more like food as medicine, where we're even bringing in the more traditional foods, in the situations as well. But we got to start with basic cooking skills like Jason is mentioning. That's the stuff that he's been teaching too. So we're all kind of working together to meet people where they are, which is exactly what Janis was mentioning too, and working together to improve health in Kansas tribes as much as we can.
Thank you. What a great conversation. And we do actually have 5 to 8 minutes maybe for some questions from the audience. Would love to hear from you, or if no questions, especially if any of our tribal community members here just have something they'd like to say and add to the conversation. Okay, we've got, yeah.
Hi, thank you guys so much. I'm from San Diego, and most of our projects with Native communities have been through urban health centers. And something that we've seen and been a part of some awkward events around because we didn't see it coming was when our youth participants who have created recipes and really wanted to take kind of leadership roles in the health of their communities have brought their projects to kind of broader convenings from the health center and not necessarily met with a lot of love and support from the elders in those spaces. And I think it's complicated because it's not as if everybody's coming from one tribe, right? Our San Diego American Indian Health Center has something, I don't know, like an unbelievable amount of tribal affiliations, like probably over 100. So it's a very complicated space, especially for an outsider, but I even think for the youth, it's a very complicated space to be living in an urban environment where they're not really tribally affiliated in their normal lives, but they have access to Indian health services, and they're trying desperately to sort of find their footing and their own identity as a Native young person. And part of the way they're doing that is through food, but even in that, it gets really fraught between, like what you're saying, is kind of the traditional foods versus the traditional reservation foods, what they're bringing out to the desert to eat at powwows, and wanting to kind of change that dynamic. So, what's your advice, or have you seen any of that tension between younger and older people in your spaces?
So yeah, I have seen that with food and elders and kids, and I think a lot of elders are. You've heard the term historical trauma. So there's a lot of anger. There's a lot of our land has been taken away. I suffer with historical trauma. I suffer with anger. a lot that comes out of nowhere, and I take it out in the weight room. That's my release. But, I've heard elders talk about, they don't even want their kids to go to higher education because it's the white man's tool, and I think it just has to do with trying to keep our culture as much as we can, even though that's, in my mind, I think we need to increase the number of, Native American nutrition professionals to come back and work with these communities, because it's hard to work with these communities. I think if you're not a Native American person, I think there's just a distrust. And so I think that has to do with the food as well. If they don't think that this food is traditional or something, and it's in one of these recipes that these kids have, then it just goes back to that distrust. So is that kind of which answers it? That was a long question. So
I think Dr. DeRoin had a question or a comment.
Oh, she always gives me these opportunities. But
Michael,
Oh, okay. Well, actually, and I would like to respond to what Jason says. I totally support what you're saying, and the good news is it is actually happening. Of course, you're a great example of that. Misty, now being our first ever chief of staff for our tribe, not to mention the first woman to hold that position, hopefully the only woman for a long time. But we have artists, videographers, journalists. I mean, it's just unbelievable. And I sometimes share with people, when I transferred into Berkeley years ago, we, looked around to find more of us, and there were 5 Native students who came together. And by the time I graduated 2 years later, there were 150 Native students at Berkeley. And the reason for that, primarily, was the Johnson's Economic Opportunity Act that actually sponsored students to, when they got accepted to a college or university, to give them money to go and study. Now, very much like the relocation program of the 60s, it wasn't totally successful because some people were going, literally from Pine Ridge or Rosebud to Berkeley in California, and it was such an enormous change that a lot of people just couldn't adapt. But things are so wonderfully happening in our communities, physicians, nurses, educators, artists. So we're really seeing positive change. Thank goodness. And I did have a question for Tandy and Janis, and that is, do you work with senior centers? Have you found that that's helpful, or is it really much better to start with the younger folks and the young parents?
We do work with a lot of the elder centers and seniors. I think it starts at the elders, because that way, if they can go back home and talk to their families and talk to their grandkids and nieces and nephews, then that kind of sells that buy-in of, yeah, this is healthy. Do it now while you're young. Don't wait till you start getting unhealthy. But just knowing that they're there to educate, and they want to educate.
Mm-hmm. Yeah, and I think I would add that the other thing that would always be true, working with elders in the Native American audience setting or outside of that too, is to understand lived experience already as well, and to celebrate that and allow that to continue to be part of the conversations as we move forward, and what can that look like too. I think as a non-Native, that piece of continuing to educate yourself personally to better understand that there is this, push and pull that is happening too between elders and younger audiences as everybody's beginning to find their way, and we are working to undo a lot of the colonial pieces that have, And so I guess I come to this space often, many times, very humbled by my interactions with coworkers, and just super thankful for the opportunities to connect and support now in whatever way we can.
I would echo that. Misty, it
I
looks
would
like
be
you
glad
have
to
a-
make one final
One
sort of
final
comment on this.
Do our mic drop.
Encouraging intergenerational sharing. If some of those youth are blessed enough to have elders in their lives, or have elders they can go to, or places in which they can connect with their elders, they should be encouraged to do that. As much as we want to also encourage leadership within them, learning from past experiences and from our elders is really, really important. I was always taught never to ask for knowledge. The knowledge will be given to you if you are worthy of it. In a situation where you might have a kind of mixed audience, asking them to share their knowledge may actually come better with saying, talk to your elders if you're blessed enough to have some. Talk to them to have them, if it's okay to even share this knowledge. Not everyone is entitled. Even if you're Native, you're not entitled to some knowledge. So sharing that in an external audience can, as Jason said, it can really trigger people for a lot of different reasons. That has nothing to do with the person asking for it, but can have everything to do with past experiences. So encouraging that intergenerational sharing with the youth and the elders and the millennials, everyone in between, to really get connected. And if there's ever a concern, talk to your elders and see what they say.
Thank you so much. That is a wonderful place to stop. If you all would join me in thanking our panel and Dr. DeRoin. Yeah. Okay.